then we will start the class.
Sure, ma'am.
So meanwhile, we can revise yesterday's topic. So Rupa and Sashikala. So would you like to give a quick review of the topic? Any topic which we had learned yesterday?
Yes, ma'am.
Yes.
We learned about the
Yes, Sashikala. Yes, Rupa. What we learned about?
12 cranial nerves,
Yes, good.
and we learned about trigeminal neurology, and it
Yes.
is central nervous system and sensor disorder, and it
Good.
has severe pain on the lips, gums, and cheeks, and the nature of the pain is stabbing and burning. It can be one
Very good.
side, twitching, blinking, and tearing. Avoid excessive hot or cold fluids and food. Chew on unaffected side. Avoid caffeine.
Yes, good.
Uh, then face has to be cleaned by soft cloth. Use a lukewarm water. The room
Very
has
good.
to be normal temperature. Communication should be with pen and paper. And medication is gabapentin and carbamazepine, and no
Yes.
massage on the face. And the treatment is surgical. It
Hmm.
is the damage, the surgery is for to remove the nerves which
Hmm.
is already dead. That is
Hmm.
rhizotomy. It's
Yes.
neurological pain management procedure.
Very
And
good.
the next one is bell palsy. It's a
Hmm.
facial paralysis, and it affects seventh cranial nerve,
Hmm.
and it causes with the viral infection, anything with viral. Uh,
Hmm.
it's what I heard is like 2 weeks before if they have any viral infection, and
Yes.
after that they have this problem bell spasm, and it is
Hmm.
unilateral facial paralysis and
Yes.
asymmetrical, and any viral infection and
Hmm.
affected side,
Hmm.
they don't have uh, a pain or anything like that. So we need to physically do the inspection. Uh,
Hmm.
the eyebrow is not raised, eyelids not closed, puffed out one cheek. And I want to add one more thing on this one. They can't even smile. Like if you
Very
tell
good.
them to smile, they can't smile.
Hmm.
And they have no wrinkles on the forehead, no pain on the face, and
Hmm.
drooping of eyes and mouth. Unilateral taste is lost,
Hmm.
and pain behind the ears, slurred speech, nasal, labial folding flat. Protect the eye from the dryness. So we use eye patches, artificial tears, or sunglasses. We should prevent injury. And I want to add one more thing to this,
Yes.
ma'am. When they sleep, especially when this kind of well spasm patients, when they sleep, they should wear a patch on the eye, because accidentally they
Yes.
will rub their eyes. So we
Hmm.
should tell them at least till they get used to it. Uh, then they have to wear the eye patch for first few days, and
Hmm.
the artificial drops must, they shouldn't skip, because if it is dry, then they cannot, they have we are giving another problem to them. So no chewing
Very
on
good.
the affected side, and we also have to tell them to check, uh, put the finger, because one side they're effective, so we should tell
Hmm.
them to check the other side also, to check with the any food is left over on the other side, and instruct the patient to look upward facial massage, like we should tell them to do the facial massage upwards. And the treatment wise, antiviral medications will give, especially prednisone.
Thank you, Rupa, so much. You gave a very good explanation. So that means you are revising. So there is Bhavna,
Good evening, ma'am.
Good evening, Bhavna. How are you?
I'm fine, ma'am.
And there is Usma. Usma, are you there?
Yes, ma'am. Good evening.
Good evening. So, have you all revised the topics?
Yes, ma'am.
Yes. Okay. So, now we will be starting a new topic that will be myasthenia gravis. You all can write this down. So, myasthenia gravis.
Autoimmune system.
Yes, it is
Weakness of, weakness of respiratory
yes.
system.
So now we will be starting the lecture and the new topic. So please all of you mute yourself. Okay. So if you have any questions, you can for sure unmute and ask the questions. So myasthenia gravis is an autoimmune disorder. Very first thing, this disorder is of neuromuscular junction. This disorder is of neuromuscular junction. So good evening, Farhad. So Farhad, we have just started with Kavaljit. Good evening. Kavaljit, we have just started with the topic myasthenia gravis. And this is the first point. Okay, you can continue. So,
And actually, sorry ma'am for disturbing you.
Yes.
I'm on duty. 40 minutes I will be free. If I will disconnect, I will just send a message.
Kavaljit, you are not audible. Can you please type in the chat box? Then I'll
Ma'am,
answer
I'm
it.
just asking. I'm on duty now. Maybe I will be disconnected after 40 minutes.
Okay. Okay. 40 minutes. You can disconnect after 40 minutes. We will be having 10 minutes break. Okay. Then you can
No
again
problem.
rejoin. Yeah.
No.
Okay. So it is an autoimmune disorder of neuromuscular junction. This is the important thing. Then second thing is there is decrease, or we can say there is no enough ACH. Now, ACH means acetylcholine. So, as we have studied, if acetylcholine is decreased, then it will lead to muscle weakness. Muscle weakness will be there. Please mute yourself. Muscle weakness will be there. Then there will be. So one thing you can write in muscle weakness is that is very specific in myasthenia gravis, in morning and in afternoon. Now what happens is in the morning the muscle strength is more as compared to afternoon. Muscle strength is more in the morning as compared to afternoon. This is important point, you can note it down. Now, sign and symptoms are muscle.
Can you go to the previous slide?
Yeah, sure. Here is the previous slide.
Okay, now you can go,
Yeah.
go forward.
One more thing you can add here is this happens more in females. This disease happens more in females and yeah. So this is more, we can see this disease more in females as compared to males and mostly in this age group. Mostly in this age group. Okay. Then
20 to 30.
Then there is muscle weakness. Muscle weakness which increases with activity. Now the muscle weakness will increase with activity. Then there will be slurred speech. Then ptosis and drooping of eyes. There will be vision loss, dysphagia. So the reason of dysphagia being the muscle weakness. So now one thing you need to keep in mind is these are the same terminologies. These two are the same. If ever you will get this word ptosis, it means drooping of eyelids. And this is the early sign.
Drooping of eyes.
Yes, the early sign of myasthenia gravis is drooping of eyes. Then there will be diplopia. Diplopia means double vision. Diplopia means double vision. Then there will be mask-like expression. Mask-like expression, which means there won't be any emotions on the face as we have. और ये किसमें थे? Now tell me one thing. हमने कल भी पढ़ा था mask-like expression. वो किसमें था?
Parkinson's, ma'am. Parkinson's.
Very good. Very good. So in Parkinson's, there was mask-like expression. अब देखो, now what can happen is exam में आपको आ सकता है this symptom. Okay, ऐसा होगा. अब now you know this is present in two diseases. You don't have to get confused. That's why it is important to relate the topics. अब आपको आज ये याद रखना है कि डिप्लोपिया हमें माइस्थीनिया ग्रेविस में भी मिलेगा and we will get this in Parkinson's as well as. Then the second thing you will be doing is comparing the other symptoms. Then you will get to know the diagnosis of that particular case. Okay? Mask-like, then there will be bulbar sign. What is the meaning of bulbar sign? Bulbar sign means difficulty in swallowing and chewing. This is the meaning of bulbar sign. Now, there will be impaired respiration. There will be impaired respiration. And the secretions will get accumulated. The secretions will get accumulated. And there will be bowel and bladder dysfunction. Bowel and bladder dysfunction. Hot potato voice, or we can also call it as mushy voice. So what is this hot potato voice? Here what happens is whenever we put something hot in our mouth, so automatically our voice will change. So that is a mushy type of sound at that time. So that sound is known as mushy sound or hot potato sound. Mushy sound or hot potato sound. Have you written till now?
Yes, ma'am. Ma'am, can you tell me what is Mulbar sign? Bulbar sign?
Sorry, you are not audible. What you are saying?
Bulbar sign?
Okay, yes. I will show you again the bulbar sign. Here it is. Bulbar sign means the patient is suffering from difficulty in swallowing and difficulty in chewing. This is known as bulbar sign. Okay,
Thank
clear?
you, ma'am.
Now I will show you different triggers. Now there are triggers. We will learn about the triggers. So, the first trigger is any infection. If there is any stress, if there is extreme weather, okay, then fever, then there is pregnancy, improper dosage. So now here is one thing you need to keep in mind. Signs of severe respiratory distress, which is very important in this topic. What will be the sign of severe respiratory distress? Hypoxia. We have learned this earlier as well. Tachypnea, cyanosis. These all will be the signs. Are you done with the writing? Yes?
Yes, ma'am.
I'm very proceeding.
So one thing here, this is very important, diagnosis. Now, its diagnosis is known as androphonian or tensilon test. This test is only for myasthenia gravis. And what they do there is, here they will give 2 mg of androphonium. They will give 2 mg of androphonium. Okay. If this sign improved, what was ptosis? What is the meaning of this sign? What does it mean?
Dropping off.
Dropping off
Dropping.
eyes.
Very good. So here, if this improves by androphonium, it means the disease is myasthenia gravis. If it is not improved, then it means there is any other disease.
Ma'am, can you please repeat it?
Yes, sure, I will repeat it. So, androphonium or tensilon, it is a diagnostic test for myasthenia gravis. Here, what they will do is they will give 2 mg androphonium to the patient. Okay, and that too in like it is 8 mg basically, but it is in divided doses. Okay.
So total we have to give 8 mg.
No,
Or
no,
2
you
mg.
don't have, okay, to make it simple for you, don't remember this dose. Just remember this thing, okay? Just you need to remember this thing. Now, in this test, what they will do is, they will give androphonium to the patient of this myasthenia gravis. Now, the sign which was ptosis, which means drooping of eyelids, if that sign is improved, if it is improved, that means the disease is myasthenia gravis. और अगर वो improve नहीं होगा, पेशेंट की आईज फिर भी ड्रूप करेंगी, उसका मतलब है कि ये जो डिसऑर्डर है ये कोई और है, ये myasthenia gravis नहीं है. Now you got it?
Yes, ma'am.
Okay. So now I will teach you few nursing interventions which you need to keep in mind. Now tell me here, airway will be of priority. Second, breathing. then circulation, ABCE as we have studied. Then you need to check gag reflex. That is very important. Why we will check gag reflex? हमने ये कल ही पढ़ा है कि हम गैग रिफ्लेक्स क्यों चेक करेंगे. यस, बताएगा कोई?
मसल्स की वजह से, क्योंकि
वेरी गुड,
जो है
very good Farhad. We will check gag reflex because of the muscles. Okay. Energy conservation methods. Energy conservation methods. एनर्जी कंजर्वेशन मेथड्स में क्या आते थे? हमने कल ही पढ़ा है. यस,
उसमें ये था कि अगर पेशेंट खड़ा हुआ है तो हम उसको चेयर दे देंगे बैठने के लिए ताकि वो
और क्या क्या?
करे, इस तरह की चीजें थी. पेशेंट की
यस,
एनर्जी बस लगे नहीं.
वेरी गुड.
और अगर वो शावर खड़े होके ले रहे हैं तो हम कहेंगे आप बैठ के ले लें.
बिल्कुल
इस तरह की
बिल्कुल
चीजें हैं.
फरहाद, वेरी गुड. नाउ चेक एस्पिरेशन. It is very important to check aspiration. Then you need to give small frequent diet. Small
Couldn't write it.
frequent. Yes.
I said I could not write the previous slide.
Okay.
Just open and I will just click a picture. Okay.
No. It's better to write. You know what happens when we take pictures? Most of the time we have gallery full of pictures, then we forget to write. So you can take your time and you can write here only. Make your notes.
I'm writing it from the pictures while you are.
Okay. Then small frequent diet. Then you need to check for aspiration as well. Then thicken up for fluid. Then you need to use soft food. Lubricate eye. Then eye patch. Then you can tape your eyes, tape the patient eyes at night. One more important thing, Medi alert should be there at the patient's wrist.
What we do, ma'am?
Medi alert means there is a bracelet type of thing on the patient's wrist. That means the patient, if there is any fall risk, the other healthcare will see that bracelet or that sticker, and he'll get to know this patient needs special care. Okay.
Yeah.
What did you write in last? The previous slide?
1 minute. Here we go.
Lubricant eye. Okay. Okay. Thank you.
Now we will talk about medicine. Pyridostigmine and neostigmine. But here is a catch. Again, star आगे फिर से highlight the points. Now, इसमें क्या है, जब भी आप ये मेडिसिन दोगे, आपको इसको you have to give before meal, खाने से पहले. और कब? 20 to 40 minutes before meal आपको देना है. It is very, very important. There are few medications. Yes.
I haven't tried the medicines here.
Okay, so here's the medicine name.
Done, ma'am.
तो जो ये मेडिसिन है, you have to give it before me. That to 20 to 40 minutes. One thing you need to keep in this in mind, you can highlight or write with different pen, whatsoever you like to do. Then there are gastrointestinal side effects of this disease. Then you need to give same time every day. You need to give this same time every day. Then one thing you need to educate in this medicine, or you need to observe as well as, if there is weakness, you need to report. Then corticosteroids you need to give. Then plasmapheresis. One thing you need to keep in mind while giving plasmapheresis is you need to monitor hypotension in this. Monitor hypotension. This you need to keep an eye on.
Monitor
Hypotension.
And can you show the previous slide, please?
Yes. So if you are left with anything, you can ask me. I will show you the slide.
Okay.
Yes, done.
Yes, ma'am. Yes, done.
Okay, let's give a quick recap. So what is myasthenia gravis?
The autoimmune disorder of neuromuscular junction.
And the cause is there is no enough ACH.
Muscles weakness.
Then muscle weakness.
In morning and afternoon.
One thing you can write here is, you can add one thing. As here, the muscle strength is more in morning, you can instruct the patient to do most of his activities in the morning. You can instruct the patient to do most of his activities in the morning, as muscle strength is more in the morning as compared to afternoon. Please mute yourself. Sashikala. Yes.
Yes, ma'am.
So next is sign and symptoms. There will be muscle weakness, which will increase with activity. There will be slurred speech, and the early sign is
ptosis, vision loss, dysphagia,
Oxygen low.
diplopia, mask-like expression, bulbar sign. In bulbar sign, we have difficulty in swallowing.
Difficult of swelling and chewing.
Then impaired respiration, secretion accumulated, bowel and bladder dysfunction, hot potato voice or mushy voice.
Mushy sounds.
Then triggers.
Infection, stress, extreme weather, fever, pregnancy, improper dosage.
And trigger and the severe, these symptoms
In
of what are
severe
these?
respiratory hypoxia, tachypnea, sinus.
And you need to report this immediately.
Yes.
Report this in any condition, in whether it is respiratory, neuro. If you're studying any condition, you're assessing for any disease. Whenever you find these three symptoms, you need to report immediately. Then The diagnosis, androphonium test or tensilon test. Here, androphonium is given, and if the toes is improved, it is myasthenia gravis. If not improved, it is any other disease. Then the nursing interventions, what you need to do, you need to have airway check, breathing, circulation. You need to check gag reflex. So can anyone tell me, like, in which situation we need to check this gag reflex? Yes.
When patient is coming post-op.
Yes. But particularly in this disease, when you will check the gag reflex?
Whenever we are giving food to the patient.
When patient have difficulty in swallowing.
Very good. Whenever you need to give any food, fluid, any medicine, you will first check the gag reflex. Then energy conservation methods, and you need to check for aspiration. Now,
small frequent diet.
hmm,
Check for aspiration. Picking up for fluid. Soft food. Lubricate eye patch. Tape the patient eye. Medillerate.
now medication,
Cholinesterase.
and the one is pyridostigmine, other one being the neostigmine. And one thing you need to keep in mind is you need to give it before
2014.
that. Yes, and there are some side effects gastrointestinal. That's the reason we are giving it before the meal. Then you need to give it same time every day. Then if there is any weakness, immediately report it
to doctor.
Yeah. So the corticosteroids are given, and then plasmapheresis is done, and you need to monitor hypotension.
Monitor hypertension.
Yeah. Now tell me one thing. What are the side effects of giving steroids?
Ma'am, it is hypernatremia, hypervolemia, edema, hypokalemia, hypocalcemia, hyperglycemia.
Very good. बाकी rest. बाकी भी बताएं what are the side effects of steroids?
Ma'am, hypernatremia, hypokalemia.
Weight gain, ma'am.
Yes, very good weight gain. So this was all about.
You know, stop it abruptly, fastly. Then other complications are hypernatremia, edema, hypervolemia, hyperglycemia, hypokalemia, and hypocalcemia.
Very good. Yes, Farhad.
Ma'am, can you please open a nursing intervention slide?
Yeah, sure.
Next one.
Okay. Any doubt, any queries in this particular topic? Yes. Any doubt, any queries in this particular topic you are having?
No, ma'am.
किसी को कोई डाउट, कुछ पूछना हो, कुछ समझ ना आया हो? Now I will teach you one scale. I will show you the image one. Have you ever heard about Glasgow-Goma scale?
Yes.
So today we will learn about that one. So what is the function of Glasgow-Goma scale? Why we give that? Any idea? Like why we use that scale?
Check the unconsciousness level of a patient.
Very good. किसी ने use किया?
Yes, ma'am. In ICU patients. A normal 13 to 15.
Stroke patient, unconscious patient.
Mm-hmm.
मैम वेंटिलेटर के पेशेंट्स के लिए
Now tell me on ventilator patient क्या हो सकता है आपका score?
Below 8, less than 8. Total score 15, 3 to 15, and when a patient have 3 to 8 point, that means coma. And
1 minute, I will teach you this scale. Yeah. So is my screen visible to all?
Yes.
Okay. Yeah. तो सबको दिख रहे Glasgow scale?
Yes, ma'am.
Okay. So here, 3 things are assessed. E, B, and M. Okay. So E stands for eye movement or eye response. B stands for verbal response. And M stands for motor response. Okay. Now, there is one way you can learn this is E4, B5, and M6. That means जो eye opening या eye response का score होगा that will be till 4 only. For example, best eye response. अब अगर आप 4 score कब दोगे? If the patient आपने observe किया कि patient spontaneously अपनी eyes को open कर रहा है without your command, without any pain, वो normally अपनी eyes को open और close कर रहा है. Okay? अब आप 3 तब दोगे जब you should note down in your notebook. आप 3 तब दोगे जब आप बोल रहे हो तब वो आई ओपन कर रहा है. लाइक यू आर सेइंग मिस्टर स्मिथ कैन यू प्लीज ओपन योर आईज और कैन यू प्लीज ब्लिंक योर आईज, तो फिर वो कर रहा है. Number 2, score 2 you will give when he will open his eyes to pain. Then 1 when there is no eye opening. So in the verbal response, 5 आप उसको तब दोगे, 5 score you will give if the patient is oriented. That means आपको कैसे पता चलेगा patient oriented है? You will ask the patient, Mr. Smith, do you know where we are? Do you know what time it is? What's the day? तो वो अगर आपको बता रहा है, तो that means he is oriented. 4 point you will give if he is confused. If either one of the question he is not able to answer. Then inappropriate words, मतलब वो बोल रहा है, कुछ ना कुछ वो words बोल रहे हैं, जैसे sometimes patient used to abuse, they are using words which are not appropriate. Then you will give 3 score. 2 you will give if it is giving incomprehensible sounds. इसका मतलब क्या है? वो sound जो आपको समझ ही नहीं आ रही. जैसे patient is doing like you as like in pain he is murmuring something in his mouth जो आपको समझ नहीं आ रहा. It is incomprehensible for you. Then you will give 2. No verbal response. If there is no response at all, then you are gonna give 1. So in the same way, best motor response. If he obeys your commands, then you will give 6. If obeys your commands means if you're telling him, can you please lift your arm? Can you please lift your leg? That means he is obeying your command and his motor response is 6. Localized to pin. Like if his hand is placed and you are just pricking with the pen and he is moving away. That means he is localizing pain, like his motor response is to pain. Then you will give 5. If withdrawal from the pain, as I mentioned, he will remove his hand away. In localizing pain, he will tell you that I am having pain, then he will be removing the hand. In withdrawal from the pain, if you are pinching him with a pen and he is withdrawing his hand, then you will give 4. Flexion to pain. He is doing flexion to pain, then 3. Extension to pain, then 2. And if there is no motor response, then the score will be 1. Now, have you all written?
Yes, ma'am.
Are you sure?
No, ma'am. In I response, what is second one? Score 2.
You are not audible. क्या कह रहे हो आप?
Ma'am,
Okay, you want me to show the screen again? Okay, okay. I'll show it again.
Sorry to disturb, ma'am. Can I leave the
Yes.
class?
Sorry, you are not
My shift.
audible. You want to leave?
Ma'am, can I? Yes, ma'am. I send you a message also. My shift
Okay,
is started.
sorry. Okay, then
No
you can like later on you can have the recorded session. Then you can make your notes, and if you have any queries, tomorrow you can ask me in the class.
Okay. Okay, ma'am. Thank you. Thank you, ma'am.
Okay, I'm sharing my screen again. So you can write down. Then I will tell you few more points.
मैम विड्रॉल पेन का जरा रिपीट करेंगे मोटर रिस्पॉन्स में
मोटर रिस्पॉन्स ओके अब उसमें क्या होगा आपको 6 तब देना है जब आप उसको बोल रहे हो कि मिस्टर स्मिथ या मिस्टर राम जो भी उनका नेम है आप अपना हाथ ऊपर करिए वो ऊपर कर रहे हैं आप अगर बोल रहे हो हाथ नीचे करो वो नीचे कर रहे हैं आपकी कमांड को फॉलो कर रहे हैं तो आप दोगे 6 लोकलाइजिंग पेन मतलब जब भी उनको पेन हो रहा है फिर वो मूवमेंट कर रहे हैं कुछ फॉर एग्जाम्पल उनको पेन हुआ उन्होंने फिर टर्न किया पेन की वजह से वो कर रहे हैं ओके फिर आप दोगे 5 4 आप तब दोगे अगर आपने उनको पेन के साथ थोड़ा प्रिक किया और आप उन्होंने अपना हाथ हटा दिया विड्रॉ कर दिया पेन से फिर आप दोगे 4 ठीक हाँ फ्लेक्शन टू पेन तो आप दोगे 3 और अगर एक्सटेंशन होगी तो आप दोगे 2 अगर कोई भी मोटर रिस्पॉन्स नहीं है देन यू विल गिव 1 तो आर यू क्लियर विद दिस
यस
any doubt any queries in this particular part yes सबने नोट कर लिए ये you all have written it
Yes, ma'am.
okay now I will give you few more points once so you can write if the score is 3 to 8 I will write it I will write it for you so that it gets easy
3 to 8 is severe deterioration condition.
1 minute I'm writing for you
मैडम जब स्कोर 3 to 8 होगा तो स्वेयर ब्रेन इंजरी होगी
yes वो मैं आपको लिख के बता रही हूँ ताकि आपको इजी हो फॉर ऑल अब बताओ 3 to 8 स्कोर कब कब हो सकता है
मैडम स्वेयर ब्रेन इंजरी में
और वो कब होगा yes in severe brain injury the patient will be in coma in severe brain injury the patient will be in coma कॉमा के पेशेंट में आपको ये स्कोर मिलेगा देन 9 to 12 means there is moderate brain injury 13 to 15 means there is mild brain injury Yes, done. इसमें किसी को
मैडम
कोई
मेरी
डाउट
साइड
होगा?
स्क्रीन ऑन नहीं हो रही, नहीं लिख रही मैं, मेरी तरफ नहीं आ रहा।
क्या हो गया उसमें आपको? व्हाट हैपेंड?
मैम स्क्रीन ऑन नहीं हो रही, जो आप राइट कर रही हो वो मेरी तरफ शो नहीं हो रहा।
Don't worry, I have written in the chat box also. You can write there. You can look from there, okay?
Okay, ma'am.
Yeah, don't worry. We have solution to all your problems. Okay, done?
Yes, ma'am.
Okay, are you ready for the question now?
Yes, ma'am.
Yes, ma'am.
Okay, I will give you the question. Write it down. The patient, you need to calculate the score. Okay, I'm just giving you a scenario. The patient opens the eye to pain, has incomprehensible sounds, and flexion to pain. What is the GCS score?
Ma'am,
13 to 15.
Give me the exact score.
Ma'am, 7.
मैम जरा
Ma'am,
दोबारा रिपीट
ma'am,
करें
please
क्वेश्चन
repeat the
coma.
question.
Yeah, I will
Ma'am,
repeat
it's
again.
7 and it's severe coma. Severe brain injury.
Listen. I am asking you to score.
7, ma'am.
यस मैम
Pain.
Ma'am, please repeat the
Open to
question.
pain to
Wait, I am
मैम
repeating the
रिपीट द
question.
क्वेश्चन
Mute yourself. All of you mute yourself. Then only you will get to know my question. Otherwise, you will get confused. Now listen carefully, okay? Question is, the patient open his eyes to verbal command. Open his eyes to verbal command. Patient is confused and the motor response is localized to pain.
Ma'am, 12.
9 to 12, ma'am.
Write your
12 to
answers.
15
Write your answers in the chat box.
Ma'am, question repeat please.
I'm once
12
again
to
repeating the question. The patient opens the eye to verbal command. The patient is confused and the motor response is localized to pain. You all got your answers?
Yes, ma'am.
So those with score 12, you are correct. You got the concept, okay? 12 is the correct answer. Okay, done?
Yes.
Any doubt in myasthenia gravis and GCS? किसी को कोई डाउट हो?
No, ma'am.
No?
नो मैम
Okay. Then our next topic will be head injury. Okay, that's a lengthy topic. So I'm giving you 10 minutes break now only. Then we are going to start our next topic.
ओके मैम
All are back? Yes. Okay, I'm going to start the next topic, which is
Yes,
head
ma'am.
injury. Our next topic is head injury. So there are two types of head injuries. First is open and second one is closed. So here in open type, there is risk of infection. And in the closed type, there is increased ICP. There are two types of head injuries. First is open, second is closed. In open type, there is risk of infection. And in the closed type, there is increased ICP. So now, if the head injury is linear, second one, it is basilar skull fracture. So here, in the linear one, there is minimum risk. In the linear one, there is minimum risk, while this one is more dangerous, the basilar one. Here what happens is there is CSF leakage. What is CSF?
Cerebrospinal fluid.
Very good. There will be CSF leakage, which is cerebrospinal fluid leakage, and this leakage will be in the eyes, in the ears, and in the nose. Okay. Yeah, Sushmita, you can leave and you can then watch the recorded session.
Please go back.
Okay. So there is one sign of basilar skull fracture. There is sign of basilar skull fracture. And that sign is Halo's sign.
Hello.
H-A-L-O. This is important. This sign is important. Now here what happens is, here the CSF, it is red in the middle and yellow outside. For example, if this is the CSF, which is coming out from the ear or from the nose, the central part will be red and the outer part will be yellow. Okay.
Yes, ma'am.
Now there will be battle sign. Battle sign means
Same in basilar skull fracture, ma'am.
we are talking about basilar because the linear one is not of that risk. Okay.
Yes, ma'am.
So we are talking about this one only. So here you will find better sign. There will be ecchymosis. There will be ecchymosis. There will be ecchymosis on mastoid. Now, what is ecchymosis? Ecchymosis is, it is discoloration. It is discoloration of skin resulting from bleeding underneath, caused by bruising. Okay, this is the meaning of ecchymosis. Then there will be, these all are the signs. There will be raccoon eyes. There will be raccoon eyes. You know what is raccoon eyes? There is one animal known as raccoon. The patient will have such eyes, which means there will be bilateral, means both eyes, periorbital chymosis. Chymosis. There will be rhinorrhea. Rhinorrhea means there will be CSF flow from the nose. Rhinorrhea means CSF from the nose. Then otorrhea means CSF from the ears. CSF from the ears. Got it? Any doubt till now? किसी को कोई doubt हो अभी? No doubt?
मैम रिनोरिया का रिपीट करें.
राइनोरिया का मतलब होता है CSF का फ्रॉम द नोज. नोज से जब CSF का फ्लो होगा कॉज ऑफ दिस हेड इंजरी, तब हम उसको राइनोरिया कहते हैं. और जब कान से होगा फ्रॉम द ईयर, इट विल बी ओटोरिया. नाउ व्हाट हैपेंस इज, जब भी बेसिलर स्कल फ्रैक्चर होगा उसमें आपको क्या क्या मिलेगा? हालो साइन, बैटल साइन, रकून आई, राइनोरिया एंड ओटोरी. ये चीजें आपको इसमें विल गेट टू फाइंड दिस थिंग्स. नाउ we will talk about another type of head injury. There is one more type of head injury which is concussion. And this is very common. What happens in concussion is there is sudden blow of head. In concussion, there is sudden blow of head. Then, because of that, there could be short paralysis. Concussion patient recover in 12 hours. There is headache and loss of consciousness. There will be headache and loss of consciousness. Done? Have you written?
Yes, ma'am.
Then one more symptom you will have. I will write it down here only. There will be retrograde amnesia. There will be retrograde amnesia. Now, what happens in retrograde amnesia? The person will forget the things, or he will not be able to call the events which occurred before the onset of the injury. The patient is unable to access memories or information before the injury. Okay. Now, you will get to see post concussion syndrome.
Ma'am, this one is a fourth injury.
Yeah, fourth one. No, this post concussion syndrome.
Yes, ma'am.
This is the part of concussion only. ये concussion का ही part है. इसमें ये बता रहे हैं कि जब concussion हो जाता है तो उसके बाद क्या होता है. ये एक syndrome है जिसमें कुछ आपको मैं लिखवाऊंगी signs. Okay. बेसिकली 4 चीजें होती हैं. फटीग होगा पेशेंट को कंकशन के बाद, उसको डिफिकल्टी होगी कंसंट्रेट करने में. Patient will face difficulty in concentration. Then there will be photophobia. Then headache. And this will persist for few days. कुछ दिनों तक रहेगा. Then automatically it will get resolved. Done?
Yes, ma'am.
Okay, now the fourth one. This is light. We will use dark shade. Is this okay? Now it is contusion. Contusion means bruising of brain, and it is very serious because there is bleeding. It means bruising of brain, and it is very serious because of the bleeding. Now there is.
Can you show me the previous slide? Done, ma'am. Done.
Then there is scoop and counter head injury. What happened in this type of injury is the head will hit. There will be injury on the front, because of which it will go back. That means scoop, and it will hit again, which means counterpoop. It will hit back. First it will hit the front part, it will go back, then again it will hit the back part. Then there is epidural hemorrhage. Epidural hemorrhage. This is between dura mater.
Ma'am, can you please explain the fifth one, ma'am?
Okay, I will explain again. So epidural hemorrhage is between the dura mater and the skull. Here,
मैम ये फिफ्थ साइन रिपीट कर दें.
which one?
मैम फिफ्थ वाला लास्ट
हाँ,
वाला.
पहले ये complete कर लो, then I will repeat it again. So in epidural hemorrhage, it happens between the dura mater and skull. Here, the bleeding will be arterial. The bleeding will be arterial. So what happens in this? If this is the head, first it will hit at the front, head will go back. Then again there is hitting at the back of the head and it will go in the front. Now you got it? First is the head. It will hit on the front. Then it will go back. जैसे हम बॉल को नहीं मारते दीवार पर. If we will like throw the ball on the ball will first go and bounce at the ball, then it will get back again. So in that way, that is known as cope and counter coop. Done?
Yes, thank you.
Now it's clear, coop and counter coop.
Ma'am, like it is the sign now that patient who have head injury.
No, it is not the sign. What I have written. It is the type of head injury, coop and counter coop head injury. आप तब से क्या कर देख रहे हो? Listen. First, head injury are of two types. Then, two types of head injury, linear basilar.
Yes.
Then, symptoms of basilar till was till here. Raccoon eyes and otorrhea. Then, this is the third type of head injury, concussion. Then, the fourth type of head injury is contusion. I have mentioned here number as well. Then the fifth type was coop and counter coop. Then the sixth one is epidural hemorrhage. Now the seventh one.
And please open epidural hemorrhage.
Okay, I will repeat it again. So here.
No, do not repeat, just open.
Okay. So here the hemorrhage is between dura mater and skull and the bleeding is arterial.
That's right.
Subdural hemorrhage. Subdural hemorrhage, it is the most common. Not subdural. Subdural is not most common. It is venous. It is venous bleed. What was the type of bleeding in epidural hemorrhage? It was arterial or it was venous?
Arterial.
Yes. And subdural will be?
Venous.
Venus.
And eighth type. Intracerebral. Intracerebral bleeding. This is the most common. Intracerebral.
I did not write the 7.
So what you are saying, Farad?
I said, ma'am, I did not write the 7.
It was subdural hemorrhage and there is venous bleeding. You need to write fast. Now in intracerebral bleeding, it is most common. There is increased intracranial pressure, loss of consciousness, and the neurological functions will deteriorate. There will be deterioration of neurological functions. Deterioration of neurological functions. You all have written this part?
Neurological function deteriorate.
Yes.
Yes.
Done?
Yes.
So here are few nursing interventions in this part, intracerebral bleeding, only in intracerebral bleeding. So here, or you can say in any head injury, you can make it common as well for all, okay? Make it common for all. For especially the basilar one and the hemorrhage one. So the very first hour is the golden period in head injury. Why we called it golden period? Because if in this hour the patient gets the treatment, he can survive.
Golden.
Golden window. You need to assess respiration, oxygen, intracranial pressure. What is GCS?
Glycogoma scale.
And any infection. These things you need to do in the very first hour. And you need to maintain the level as well. Now, there are few things which you need to ask the patient if patient is conscious. If patient conscious. Okay. Here, you need to ask the question if he is having any vision problem, if there is any vision problem, nausea, vomiting, headache, nausea, vomiting, headache, muscle activity change, nausea, vomiting, headache, muscle activity change. If any of these things happen, you need to immediately report. You need to immediately report. You need to immediately.
मैम इसमें ब्लीडिंग हो सकती है नाक से और एयर से ब्लीडिंग भी हो सकती है ड्यूरिंग जब आप इसके साइन सिम्टम चेक करें तो फिर इसमें ब्लीडिंग फ्रॉम एयर एंड नोज
यस मैंने आपको लिखवाया ना उसमें बेसिलर स्कल फ्रैक्चर में कि उसमें ब्लीडिंग भी हो सकती है और उसमें CSF का भी फ्लो हो सकता है. Mostly there is CSF flow and that indicate basilar skull fracture. Okay. Okay, Usma?
Okay. Okay, ma'am.
So done with this part?
Yes, ma'am.
Now you need to educate few things to the patient. You need to educate him. No alcohol. No alcohol. No driving. No contact sport. What is contact sport?
To meet the
Contact sport
Like
means
football,
and
basketball, everything.
yes, these
sport.
games are known as contact sport. Then no hot bath. Hot bath for 1 to 2 days. No hot bath for 1 to 2 days.
Hi, ma'am. What's the reason?
The reason being there is injury. There could be any injury in the patient and the hot bath. Now tell me, hot, if there is anything hot, it will do vasodilation or vasoconstriction.
vasodilation.
Vasodilation. तो अगर पेशेंट की बॉडी में किसी टाइप की ब्लीडिंग हो रही हो या कुछ हो रहा हो तो हॉट बाथ से क्या होगा? वेजोडाइलेशन हो जाएगी. सो इन दैट केस हम पेशेंट को कहते हैं आप 1 से 2 दिन तक हॉट बाथ ना लें. ओके, ये चीज यू नीड टू कीप इन माइंड. If there is anything hot, it will lead to vasodilation and cold thing will do vasoconstriction. Okay. So done with this part?
Yes, ma'am.
And can we revise?
Any doubt, any queries till now?
Oh, ma'am.
Okay. So here, now what was the first thing? Yes. How many types of injuries are there?
2.
There are
Open
open and
Open and
closed.
close.
In open, we have risk of infection, and in closed, there is increased ICP. There are 8 types of head injury. First is linear head injury. Second is basilar skull fracture, which is more dangerous.
Mm-hmm.
And there's CSF leakage from eyes, ear, and nose.
Mm-hmm.
And their sign and symptoms are: sign of basilar skull fracture is halo sign.
Now
And
what happens is, let me give you one point in hello here. What happens is sometimes we get confused with the blood and the CSF. So for that purpose, the hello sign is there. What they do is sometimes blood mixes with the CSF. So hello sign will help to detect the CSF because that will be yellow from the outside and red from the inside. Okay, keep this in mind.
Yes.
Now the next is
battle sign.
Battle signs.
In battle sign, we have ecchymosis on mastoid, which is discoloration of skin resulting from bleeding underneath caused by bruising.
then next
Then
is
recognize,
mm,
which is bilateral periorbital ecchymosis. Then rhinorrhea. Rhinorrhea is CNS flow from the nose, and otorrhea, CNS flow from the ear. Then
next is concussion, which
concussion,
is
it is a very common. And in concussion, there are sudden blow of head, short paralysis,
mm,
and recover in 12 hours, headache, loss of consciousness, retrograde amnesia, and after that, post concussion syndrome, which is very important.
mm-hmm.
And
Good.
there are fatigue, difficulty in concentration, photophobia, and headache, which stay for a few days.
Yes.
And contusion. In contusion, patient have bruising of brain, and it is a serious type.
Yes.
And because it is a serious, then patient having bleeding, and then it lead to hemorrhage.
Yes. Next is post-concussion syndrome, fatigue, difficulty in concentration, photophobia, headache. Then there will be a contusion, which means bruising of head, bruising of brain, then poop and counter poop.
Yes,
Then there is epidural hemorrhage, subdural hemorrhage, intracerebral hemorrhage, and there is last thing, the which are the nursing interventions. Okay,
yes.
that's all about head injury. Now we are going to start new topic. Any confusion, any doubts?
Ma'am, how many topics are left?
So there are few more topics we need to cover today only, because today we are going to wind up with this nervous system. Okay.
Can you please open subdural hemorrhage?
So now I have cleared the whiteboard. So what you want to know from the subject?
I know, but I did not write it. I wanted to write the exact what you.
Subdural hemorrhage is venous bleeding.
You need to write only the venous bleeding. That's it.
Now what is in?
Yes.
What is the meaning? Anal box.
कोई कुछ पूछ रहा था. I think someone was asking a question. Okay, let's continue. So spinal cord. So in spinal cord there are 31 pairs of spinal nerve, and those are C8. ये हमने पहले भी पढ़ा हुआ. किसी को याद है? Yes.
Yes, ma'am.
C1 to C3. This is for neck. This is for shoulder. This is for bicep. This is for wrist, tricep, and grip. So the cervical injury is life-threatening. This is life-threatening. So what happens in thoracic? Legs are controlled. In lumbar, legs as well as shoulders.
Ma'am, thoraces.
Legs. These are the nerves. I'm talking about the nerves. Lumbar nerve. Yeah. So whenever there is any spinal cord injury, you need to keep few things in mind. So priority in spinal cord injury. First, neutral body posture. Second is respiration, oxygen, suction, fluid, neurostatus, which is GCS score, your muscle strength, and there is a type of traction which is for the cervical, which is for the spinal cord injury, which is known as the halo traction. We will get to know about the musculoskeletal system. These are the priorities. So here, if the injury is above L1 nerve, then there is spastic bladder, which means there will be automatic empty or leaking of bladder. Spastic means there will be spasms due to which there will be automatic emptying or leaking of the bladder if the injury is above L1. Now, if the injury is below L1, L2, the bladder will be flaccid. Flaccid bladder means there will be no muscle tone. There will be no muscle tone, because of which the patient will not feel fullness of bladder. So now what will happen in particular this scenario if the bladder is flaccid? Now what happens is, if the bladder is flaccid, okay, now in the bladder urine is there. Because of urine, the bladder is full. The bladder is full, but there will be no emptying of the bladder because the patient won't feel any fullness feeling. Then what happen will be, urine will go back to kidney and it will lead to infections. So now here in this scenario, what we will do is we will insert intermittent or we can say in or out catheter, because it is very important to remove urine from the body. So that's the reason we will be inserting this catheter. This is also known as Craig's method, where we push the bladder downwards. You all have written till now? Yes?
Yes, ma'am.
Yes,
Okay,
ma'am.
now there is one very important thing, which is Brown's Sequard syndrome. Now, what happens in this syndrome is half of the spinal cord will be broken. Half of the spinal cord will be broken. That could be due to trauma, any tumor, any inflammation, ischemia. Because of these reasons, the spinal cord could be broken. Now, what happens?
Ma'am, please show the previous slide.
Let me explain first. The half broken spinal cord. The half broken spinal cord, or we can say the broken part. In the broken part, there will be, what there will be? There will be paralysis. There will be deep touch loss. And there will be loss of motor function. This will all happen in the which part? In the broken part. Now, what will happen in the other part will be the one which is intact, the opposite side, because half of the spinal cord is broken, but half is intact. In that part, there will be loss of sensation and loss of light touch. In the broken part, there is loss of deep touch. So all you all have written till now.
Ma'am, deep touch in there.
देखो क्या होगा इसमें?
मैम
अब ये स्पाइनल कॉर्ड है, ठीक है, हाफ ब्रोक होगी, आधी टूट गई, जो टूटी है ना ये वाला पार्ट, इसमें क्या होगा? डीप टच का लॉस हो जाएगा, मोटर फंक्शन का लॉस हो जाएगा और इसमें पैरालिसिस भी हो जाएगा, इसमें ये सब होगा। बट जो ये है, जो इंटैक्ट है अभी भी, जो बची हुई है आधी, उसमें सेंसेशन की लॉस होगी और लाइट टच की लॉस होगी। ये कौन सा स्लाइड यू वांट मी टू शो?
मैम द प्रीवियस
Ma'am, last
Previous one.
वाली slide.
yeah this one
Yes, ma'am. इससे आगे.
after that
Yes, ma'am.
Now we are going to start with the neurogenic or the spinal. Let me write it down for you. Neurogenic or the spinal shock. Here you need to highlight two things. You will find hypotension. You will find hypotension and you will find bradycardia. These two things you will get in neurogenic or spinal shock. There will be loss of sympathetic nervous system. Sign and symptoms. Areflexia will be there. There will be paralysis. There will be warm, flushed skin. There will be problem in temperature regulation. In neurogenic shock, the patient will face problem in temperature regulation. He or she will face problem in temperature regulation. Done till now? Yes.
Yes, ma'am.
One more thing you need to write is paralytic ileus. Now, what does it means is paralytic ileus means the normal movement of digested material through your intestines slows down or it can stop. The movement of digested food from the intestines will stop even if there is no physical blockage. Or we can say, in other words, there is paralysis of the intestinal muscles. Yes, Rosaline, you can leave. Then you can watch the recorded sessions. I think she has already left. Is she there, Rosaline? Any doubt in what is paralytic ileus? Yes.
No, ma'am.
क्या होता है बताओ फिर कौन
Ma'am,
बताएगा
movement of digestive food in intestine is stopped or paralyzes in intestinal
very
muscles.
good very good Bhavna. So here we have few interventions. Here you need to monitor hypertension, bradycardia, vowel sounds, pressure ulcer, and DVT. DVT means deep vein thrombosis. DVT means deep vein thrombosis. DVT means deep vein thrombosis. So here what happens in this is there is any blood clot which can form in the deep vein, that too especially in the legs. Here there could be any blood clot in the legs which can cause pain, swelling, redness and warmth. Then you need to instruct about range of motion exercises. Then compression stockings. Compression stockings will help in prevention of DVT. It will help in the prevention of DVT. Then hypertension could be orthostatic. So here you will instruct the patient to change the position very slowly. You will instruct to change the position very slowly. Any doubt, any queries till now? Yes. किसी को कोई doubt हो, किसी को कुछ query हो?
Ma'am, can you please tell me what is this RO max an exercise. Three.
It means range of motion exercises. We instruct the patient to do different range of motion exercises. इससे क्या होगा, अगर वो रेंज ऑफ मोशन एक्सरसाइजेस करेगा तो उससे डीवीडी के या क्लॉट बनने के चांसेस कम होते हैं. ये बेसिकली क्या करता है, ये हमारे जॉइंट्स की फुल मूवमेंट के ऊपर फोकस करके जो रेंज ऑफ मोशन की एक्सरसाइज करते हैं. इससे क्या होता है, ये एक्सरसाइजेस आपकी फ्लेक्सिबिलिटी को भी इम्प्रूव करेगा, जॉइंट फंक्शनिंग को भी इम्प्रूव करेगा और ये स्टिफनेस को भी रिड्यूस करता है. As you know, patient को paralysis है, so not paralysis, the patient is having risk of this DVT and there is neurogenic shock. So हम patient को कहते हैं कि ये exercises करें ताकि जो उनके मसल्स हैं, उनकी जो जॉइंट्स हैं वो स्ट्रेंथन हो और बॉडी में जो भी स्टिफनेस है वो कम हो जाए. क्लियर? What is the meaning of areflexia? Yes, areflexia का मतलब है कि उसकी बॉडी में कोई
Absence of reflexes.
Yes. Then, what is the meaning of paralysis? Paralysis. पैरालिसिस, हाँ, पैरालिसिस का मतलब ये होता है कि आपकी जो बॉडी के मसल्स हैं और जो नर्व्स हैं, दे आर नॉट वर्किंग. उनको एक्टिवेट करने के लिए हम क्या क्या कर सकते हैं? यस फरहाद.
फिजियोथेरापी.
फिजियोथेरेपी में क्या होता है?
Exercises, range of motion exercises.
Yes, yes. Okay, now any doubt, any queries till now you are having?
No, ma'am.
All clear till now?
Yes.
So
Yes.
we are left with few more topics, okay, that we will be covering today. So I will give you a break of 10 minutes. Is it okay for you?
Okay, ma'am. What topics are ma'am?
There are three to four more topics such as seizures. There is narcolepsy, and I need to give you some diagnostic test as well. So then we will be winding up with a nervous system, okay, neurological disorders. So after
Okay,
10
and ma'am,
minutes, yes, Farhad.
and what about pharmacology of nervous system?
So here, according to diseases, you have learned about their medical management. So for these particular diseases, you are done with the medicine which is required. You don't have to worry. If there is anything necessary, you will be getting everything here only. Okay. Okay.
Okay, ma'am,
After
thank you.
10 minutes, we will start the session again. So you guys can relax for a few minutes. Okay.
Okay, ma'am.
So let's start with the next topic. Autonomic dysreflexia. Autonomic dysreflexia is your new topic. So here, it is also a type of spinal cord injury, but here the spinal cord injury is above T6. The spinal cord injury is above T6. And because of that, there is sudden, severe, throbbing headache. Sudden, severe, throbbing headache. Then there is severe hypertension. Severe hypertension. And hypertension is more than 200 mm of Hg. There is restlessness. There is anxiety. There is piloerection. Blurred vision. Nausea. Bradycardia. Dilated pupil. Nasal stiffness. Done with the writing? Yes? लिख लिया
Yes,
यहाँ तक
ma'am.
सबने?
Yes, ma'am.
Okay. So piloerection का मतलब होता है गूज बम्प्स. सबको पता है गूज बम्प्स क्या होते हैं?
Yes, ma'am.
Yeah, so that is in medical term we call it as piloerection. Then there is nasal stiffness. Then there is flushed face. And here the triggers are pressure ulcer, bladder distension, constipation, wrinkled bedsheet, UTI, cold temperature. Here the treatment will be for the hypertension. What position you will give? Hypertension, what position you will give? You will give high polarization. This was about this disease, and it is very important. Very, very important. To be very specific, you need to memorize its signs and symptoms. This is very important disease.
Autonomic dysreflexia.
Yes, Pavna?
I'm just, ma'am, saying the name that it is important. Autonomic dysreflexia.
Yeah, autonomic dysreflexia. Okay. Done with this disease. Any doubt, any queries in this disease, particular disease? Yes. Any doubt, any queries?
Can you please go to the next slide? Okay, we have studied. Yes.
Now we are going to start our new topic. Topic is seizures. So here in seizures, there is decrease in sodium, calcium and magnesium. There is decrease in sodium, calcium and magnesium. So these are the causes. Hypoglycemia, stress, decrease in sodium, calcium, magnesium. These are the causes of seizures. These are the causes of seizures. Then, now the types. So here, the first type is generalized random seizure. Generalized random seizure, and here aura is present. Aura is subjective sensory experience that happens before seizure. It is a kind of warning sign, we can say.
And subjective sensory
Experience. Okay. So now there are further types of generalized grandimal seizures. The first one being tonic-clonic seizures. So here, just remember this thing. The word tonic means stiffness and the word clonic means jerking. Now tell me one thing. इसमें क्या होगा? Stiffness होगी या jerking होगी? Yes. टोनिक क्लोनिक जो सीजर होगा इसमें आपको स्टिफनेस होगी या जर्किंग होगी?
दोनों.
वेरी गुड. क्यों? टोनिक का मतलब बस अब इसका ये वर्ड का मीनिंग याद रख लो. You will never get confused in the types of seizures because this is the most confusing topic. This is very simple way to learn it. Tonic means stiffness, clonic means jerking. That's it. There will be loss of consciousness in this and there will be fatigue. Okay?
Yes.
Now, your next is, second one is the tonic seizures. Here, in tonic seizures, मैंने आपको क्या बताया था? What is the meaning of tonic?
Stiffness.
इसमें क्या होगा?
Stiffness होगी.
इसमें there will be only muscle stiffness. क्या इसमें jerking होगी? ये 30 सेकेंड to 1 minute तक का हो सकता है. There could be loss of consciousness and the patient might fall.
30 seconds.
In tonic seizure, there will be stiffness of muscles It will be around 30 seconds to 1 minute. There will be loss of consciousness and the patient might fall. Now, the third type is clonic seizures. Now, tell me what will happen in clonic seizures.
Jerky movements.
Yes, there will be repetitive jerking. It can happen for few minutes. It can happen on one side or both sides. Done. Now, the fourth one is myoclonic seizures. Now, the word clonic means stiffness. Stiffness or jerking, yes. What is the meaning of this word?
Jerking, ma'am.
Good. That means you were present in the class. Clonic means jerking, but there will be brief jerking. And there will be stiffness, not of muscles. There will be stiffness of only extremities, only extremities. Then the fifth one
Ma'am,
is
this is jerking, right, ma'am? But you said like
here, what I have told you, there will be brief jerking of the body, but there will be stiffness only of
Extremities.
You need to keep this in mind. In myoclonic, there will be jerking, but there will be stiffness only in the extremities. Now, atonic seizures. The word atonic means there is no muscle tone. If there is no muscle tone, body में कोई tone ही नहीं है, the person will collapse. The person will fall, and if the person will fall, there is injury. And if the person will fall suddenly, there is risk of head injury as well. Now, the next type is absent or petitmal seizures. Petitmal. So, highlight one thing here. You need to highlight. This seizure is present in children. This type of seizure is in children. Here, the patient is awake, but there will be involuntary behavior. He will be smacking his lips. He will stare at one particular thing and he might not be conscious. And one more thing is there. Automatism can be seen here. Now, automatism का मतलब क्या होता है? It means the patient will perform actions but without conscious thoughts. Or he is not performing voluntarily. The action will be involuntary. The action will be involuntary. So done till now, यहाँ तक हो गया सबका?
yes, ma'am.
देखो हमने पढ़ा फर्स्ट टाइप क्या थी, हमारी जनरलाइज्ड ग्रैंडमल सीजर्स, ठीक है, राइट, यही पढ़ा ना हमने।
यस मैम।
फर्दर ये देखो जो ये है ना आगे, ये इसके ही फर्दर सब टाइप्स हैं। फर्स्ट इज टोनिक क्लोनिक, सेकंड इज टोनिक, थर्ड इज क्लोनिक, फोर्थ इज मायोक्लोनिक, fifth is
Autoclonic.
atonic, then there is petit mal, which is also known as absent seizure, which is in children's. Now अब जैसे हमने फर्स्ट क्या पढ़ा था, ग्रैंडमल, so the second is partial or focal seizures, इसके फर्दर दो टाइप्स हैं। उसके कितने टाइप्स पढ़े थे हमने,
5
यस, और इस कितने पढ़े थे हमने,
5
6 पढ़े मैम।
आपने
6
5 टाइप्स पढ़े,
6
देयर आर 6 टाइप्स, काउंट करो फिर से। अब इसके सिर्फ दो टाइप्स हैं, फर्स्ट इज सिंपल एंड द अदर वन बीइंग द कॉम्प्लेक्स वन। अब जो कॉम्प्लेक्स होगा इसमें देयर विल बी लॉस ऑफ अवेयरनेस एंड कॉन्शियसनेस, और जो सिंपल होगा इसमें patient will be aware, he will be conscious, there will be pain which won't be usual, the heartbeat will increase or heart rate will increase. Now we will study about seizures.
Please show the previous one. Done ma'am.
Now highlight this thing. Now the topic which these highlighted can add 10 stars. This is that much important. Seizure precautions. First is side lying position. Second is nothing in mouth. Third is loose cloth. You will instruct the patient to wear loose clothes. Then safe place. Then side rails. And you need to do padding to the side rails so that there is no risk of injury.
Excuse me, ma'am, how many side rails we need to up?
Sorry, I didn't get your question.
Ma'am, how many side rails we need to up?
There are only 2 side rails in the bed.
Okay, ma'am, thank you.
The bed, okay, you need to pad those side rails.
Okay, ma'am.
So what else? You need to keep pillow under neck. Need to keep pillow under neck or lap. Then do not hold their hands. The reason being because of their grip during the seizures. Then when there is seizure, you need to record the time of seizure. You need to record the time of the seizure, and you need to keep 2 things. First is you need to keep suction apparatus. Second, you need to check the oxygen level, and you need to have the oxygen with you as well. Then after seizures, post seizures, what all things you will do? You will assess vital signs. You will provide sideline position. You will provide rest. Reorient the patient where he or she is. Assess whether there are any injuries present. Then neurological check you need to do. If the patient is agitated, you need to calm the patient, relax the patient, and look for any triggers. Look if there is any trigger such as excessive lightning, there is any noise, such things you need to avoid. You need to provide very calm environment. Now there are few health teaching for the seizure patient. Health teaching is always tell the patient to wear helmet. Wear helmet, reduce stimulation, then do not lock bathroom. Now the diagnosis. You will do ECG. Now before doing the ECG, what you will do?
And can you please go back?
Okay, first let me complete this. You need to instruct the patient to wash hair before, and if there is any oil present, patient need to wash that also. Then no stimulant. Patient should not have any coffee, any stimulant before the ECG. This is EEG, sorry, EEG. EEG, you know the full form of EEG?
Electroencephalogram.
And the purpose? Its purpose is to look for or to assess the activity of
brain.
Yeah. Okay. Yeah. So no stimulants and no seizure medication should be taken by the patient. Okay, done. You need to hyperventilate the patient so that there is no lack of oxygen. Then the patient should not be on NPO. Do not keep the patient on NPO before this EEG procedure.
Why, ma'am?
You need to provide him adequate food so that he do not feel any dizziness. There is no hypoglycemia, because in hypoglycemia also you will see the symptoms such as confusion, dizziness. So in order to avoid any other symptoms, that's the reason we need to keep the patient not on NPO. No NPO means no, you should give the patient food. ऐसा नहीं होगा कि आप पेशेंट को बोलोगे कि आपने इस टेस्ट से पहले खाना नहीं खाना. You can instruct the patient to have the food, but not the medicine, not the seizure medicine. Okay.
Yes, ma'am.
We're done.
Yes.
Now we will look at the stages of seizures. There are 4 stages. The first one being prodromal. इसमें क्या होता है, पेशेंट को फील होता है कुछ दिनों पहले ही. The patient will feel some days before the seizure. क्या फील होगा उसको? उसको फील होगी एंजाइटी, उसको होगा एंगर, उसको होगा डिप्रेशन, उसको होगा स्लीपिंग प्रॉब्लम. He will face sleeping problem. These all problems will be faced by the patient in prodromal phase because this is before the seizure. Now, aura. It is before the seizure, but few minutes or few seconds before seizure. सीजर के कुछ मिनट पहले या कुछ सेकंड पहले जो स्टेज होती है उसको हम कहते हैं ओरा. Then is इक्टस. इक्टस वो स्टेज होती है जिसमें एक्चुअली सीजर हो रहा है. तो हम कहते हैं, और इस की एक चीज you need to keep in mind is in ictus stage you need to keep the priority as airway. Then post ictus means after the seizure. Post ictus means after seizure. Here also you will have the airway priority. Then you need, the patient will feel headache, the patient will be confused, the patient will be disoriented. These all are the stages of seizures. Any doubt, any queries in the stages? Now, next is status epilepticus. Here, अब क्या होता है, अगर जो सीजर है, सीजर 30 मिनट से ज्यादा हो और उसको रोका ना जा सके, it is hard to stop, we will call it as status epilepticus, and this is an emergency situation. This is an emergency situation. रीजन क्या है इसका emergency situation का? क्योंकि इसकी वजह से पेशेंट को हाइपोक्सिया हो सकता है. अब इसके रिस्क फैक्टर क्या हैं?
Ma'am, show the first slide.
1 minute, let me complete it. If there is any drug withdrawal, if there is any head injury, if there is fever, if there is edema, these all things can lead to prolonged seizure. Now here, during this you need to notify immediately.
Ma'am, risk factor I haven't tried.
You need, okay, you can write at the last. You need to notify immediately. What you will notify? The healthcare provider. Then you need to maintain airway. You need to provide oxygen. You need to have IV access in that patient so that the medicine can be administered, and you will administer this medicine. Benzodiazepine. And you will also assess oxygen via pulse oximeter and ABG analysis.
Done, ma'am.
Done. So here, one thing you need to keep in mind is airway. Your priority is airway. Airway is your priority. Now we will talk about medicines. These are very important medicines. In neuro, seizure medications are of very importance. Seizures and the Parkinson's medicine, levodopa and carbidopa, and the things you need to keep in mind. Here, the medicine which you will give is quinine, and this is very important. Highlight this point. This medicine is very, very important, and it will be given 10 to 20 mcg per ml. It has some side effects such as it causes osteoporosis. You need to instruct, do not stop abruptly. Do not stop abruptly. Reason being, if stopped abruptly, it will lead to status epilepticus. And here you will instruct the patient to have folic acid supplement, vitamin D and calcium, because it leads to osteoporosis. Then it can also lead to toxicity such as hepatotoxicity. That's why That's the reason its dose is 10 to 20. You need to monitor this dose vigilantly. Then hyperglycemia. Then bone marrow suppression. In bone marrow suppression, it can cause anemia, decrease WBC, platelet. This is very important point. It causes gingival hyperplasia. So here you may need to maintain hygiene. Here you need to maintain hygiene. Now, you have done with all this? Yes.
Yes, ma'am.
Now,
gingival hyperplasia क्या होता है?
yes.
Gingival hyperplasia.
You are asking about its meaning, right?
Yes, ma'am.
Bleeding of gums.
में क्या होता है? हाइपरप्लेजिया का मतलब क्या होता है? हाइपरप्लेजिया मींस ओवरग्रोथ, राइट? इसमें क्या होता है? जो हाइपरट्रॉफी हो जाती है किसकी? गम्स की. जो गम होते हैं वो टीथ के ऊपर या उसके अराउंड उनकी हो जाती है ग्रोथ, एक्सेसिव ग्रोथ.
Excess growth of gums.
बिकॉज हाइपरप्लेसिया का मीनिंग होता है किसी भी सेल की ओवर ग्रोथ, और जिंजिवल का मीनिंग होता है योर गम्स. इसमें क्या होता है? ओवर ग्रोथ हो जाती है गम टिश्यू अराउंड द टीथ. ओके.
Yes, ma'am.
Now there are few early signs of toxicity which you need to report. Okay. Early signs of toxicity. Nystagmus, ataxia, slurred speech, and tremors, rigidity, and postural instability. और लेट साइन में क्या आता है? lethargy, confusion, and coma. What is the meaning of ataxia? Yes. Lack of muscle coordination is known as ataxia. Lack of muscle coordination, you can write. And you need to report Stevens-Jones syndrome. You need to report Stevens-Jones syndrome. In this syndrome, there is rashes which develop all over your body and skin start to peel off. Increase body hair. These things you need to report. Decrease contraceptive effectiveness. Decrease contraceptive effectiveness. And if there is depression, you need to report because it can cause depression. One thing you need to keep in mind is phenytoin is never given with warfarin and lithium. You will never give with warfarin and lithium.
Ma'am, why?
because it interacts with these two drugs and it will lead to adverse effects. Your next drug is levi one second, levetiracetam. Levetiracetam. Now here you need to instruct few things. No driving. There could be drowsiness. You need to instruct this to patient. There could be drowsiness. There could be depression. And you need to check for the suicidal ideation. If the person is having suicidal ideas, then it can also lead to Steve Johnson syndrome. The next drug is, the third drug is lamotrigine. Lamotrigine. This is safe in pregnancy. This can be given in pregnancy. If the pregnant woman is having seizures, we can give this medicine. The fourth one is more common. It is gabapentin. Remember one thing, gabapentin is also given in neuropathic pain, the pain because of nerves. It can also be given in neuropathic pain. Next is valproic acid. This
Neuropathic.
pain, neuropathic pain. Now, valproic acid will also lead to this is also hepatotoxic. It can also lead to hepatotoxicity, bleeding. There will be bleeding from the gums, or there could be melena, which means bleeding in the stool. Then there could be nausea, vomiting. It can lead to pancreatitis. And you need to report if any of this happens. You need to report if any of this happens.
What is after nausea and vomiting, ma'am?
It is pancreatitis.
Oh, okay.
Now, the sixth one is barbiturates. Barbiturates such as lorazepam or diazepam. Now, this one is short acting. This one is short acting and this one is long acting. This one is given first. This one. Short acting is given first. So guys, this was all about your neurological disorders. There are two things left. One is narcolepsy. One is narcolepsy and other is few scans and diagnostic procedures.
मैम इसमें नर्सिंग इंटरवेंशन है.
इसमें ये नर्सिंग इंटरवेंशन से तो बताएंगे आपको जो आपने रिपोर्ट करना है. These things you will report. और जो ड्रग्स में आपको रिपोर्ट करना है सब बताया.
Okay.
So this is the most important drug part of the nervous system. This one question, you will get questions from this one as well as the Parkinson's one. And the steroids, these things you need to keep in mind. Okay. Done?
Yes, ma'am.
Yes.
ma'am.
So I think you guys are tired, right?
Ma'am, can you please show the slide? Report Stephen Jones syndrome.
So now I have closed my whiteboard. These are not the slides. These I am writing over here. You can write. You want to know what is Stevens-Jones syndrome, right? Rashes develop all over your body. Your skin will peel off. There will be increased body hair. The effectiveness of contraceptives will decrease and it will cause depression, and you will not give it with warfarin or lithium. And all these signs you need to report immediately.
Ma'am, it is life-threatening condition, Stephen Johnson.
Yes, it is. That's the reason you are reporting it. You are reporting only those things which are life-threatening. That's why I have specially mentioned to report immediately to the healthcare professional. Okay.
Yeah.
So now we are left with two topics. One is narcolepsy and other one is diagnostics. That we will be discussing on Monday or Tuesday. Monday you will be having mock test.
Ma'am, is it possible like we will give mock test on Tuesday because it takes time to learn?
Not in you are not prepared. Am I right?
Yes, ma'am.
Or you want a time because it's I know this system is has so many disorders. Okay, not an issue. We will schedule it for Tuesday because
Yes, ma'am.
because you get questions from the diagnostics. That's the reason I am the postponing the test. Okay. So any doubt, any queries right now you are having?
No, ma'am.